The color of urine. What every shade reveals about health. What can the color of urine tell about the hidden state of the body? This question, often overlooked, carries answers that may save health or even life. Anna Good has long studied how the human body whispers its secrets through seemingly trivial details. One of the clearest signals is urine color, an everyday phenomenon that can transform into a medical alarm. But what does each shade really mean, and when is it time to worry? From the very first glance, the topic seems simple. Urine is either light or dark, depending on hydration. Yet behind every nuance of its spectrum hides a story, sometimes harmless, sometimes urgent. Could a shift from pale yellow to amber be a matter of life and death? That is where the exploration begins. The composition behind the colors. Urine consists of 95% water and 5% dissolved substances, sodium chloride, electrolytes, urea, creatinine, and other byproducts of metabolism. It is this complex mixture that paints urine in shades of yellow. Normally, the body produces a soft, lemonade-like hue, a sign of balance, where hydration and metabolism harmonize. But equilibrium is fragile. Once the body drifts from its optimal state, colors deepen, fade, or take on strange new tones. Why does that happen, and what should one suspect first when the stream of urine turns unusual? The answer lies in each shade's hidden meaning. Crystal clear, more than just water, the first stop on this spectrum is clear urine. At first glance, it seems like a symbol of purity, a body cleansed and hydrated. Yet in reality, constant clarity often betrays overhydration. When fluid intake overwhelms the body's needs, the blood can lose crucial electrolytes like sodium, creating dangerous imbalances. Though a clear stream after heavy water drinking isn't alarming, persistence of transparency may signal that something is off. Could excessive clarity conceal a silent problem brewing within? The ideal lemonade yellow. The most desirable shade is a pale yellow, resembling diluted lemonade. In this state, hydration is perfect, neither too much nor too little. The kidneys filter with ease, and the body functions without strain. But even here lies a subtle reminder. Any drift away from this shade toward dark amber or toward transparency hints at imbalance. Like a traffic light, the urine shifts before danger strikes, warning those who pay attention. What happens, though, when the yellow deepens beyond recognition? Dark yellow to amber, a signal of thirst. When urine turns dark yellow or amber, concentration has taken over. This typically means fluid intake has been too low, forcing the kidneys to conserve water. Imagine a stream shrinking to a trickle in a summer drought. The body mirrors this survival mode. At this stage, the cure is usually simple: water. Yet, if ignored, dehydration builds up quietly, damaging organs and disrupting energy. Could a glass of water prevent the fatigue and headaches that follow such changes? Quite possibly. But not every abnormal shade is so benign. The unexpected orange. Few expect to see orange urine, yet this shade is surprisingly common. Sometimes the culprit is medication. Phenazopyridine, prescribed for burning during urination, can dye urine a vivid orange. Sulfasalazine or certain laxatives can do the same. Even a meal rich in carrots or sweet potatoes, packed with beta-carotene, leaves its mark. Orange also appears when urine is highly concentrated, intensifying its natural pigments. But how to know when orange is harmless and when it signals danger? The trick lies in persistence. If hydration fails to restore the usual yellow, deeper causes might lurk beneath. Could this seemingly innocent color be hiding a brewing disease? Red, the most frightening shade. Perhaps the most alarming sight is red urine. It immediately raises one terrifying thought: blood. While sometimes linked to harmless factors such as eating beets, rhubarb, or blackberries, or taking medications for tuberculosis, red can indeed mean hematuria, the presence of blood in urine. Blood in urine demands attention. STANDARD medical investigation involves urinalysis to detect red cells or infection, urine culture if infection is suspected, CT scans of the abdomen with and without contrast, checking kidneys, ureters, and bladder. Cystoscopy, a camera inspection of the bladder, searching for tumors, stones, or structural anomalies. Blood tests like serum PSA, probing for prostate cancer. In nearly 15% of patients, these tests reveal significant findings, stones, cysts, tumors, or malignancies. Yet, in many others, no cause emerges. Does the absence of answers reassure, or does it leave more questions than before? Brown, when the stream darkens to Coca-Cola. If urine turns brown, cola-like, or tea-colored, suspicion rises further. One possibility is rhabdomyolysis, a dangerous breakdown of muscle fibers after extreme exertion. Athletes and soldiers sometimes face this condition after intense strain. Brown urine here signals muscle proteins spilling into the bloodstream, threatening the kidneys. Weakness, pain, and dark urine together require immediate emergency care. Brown may also reflect liver or kidney disease, or even Tylenol intoxication, when excessive acetaminophen damages the liver. Unlike other shades, brown carries weight. It rarely passes unnoticed, and for good reason. Could this be the body's most dramatic plea for help? The rarest blues and greens. Sometimes, urine defies expectation, turning green or blue. Uncommon yet striking, this change usually arises from certain foods like asparagus or blueberries. Medical dyes such as indigo carmine, methylene blue, or fluorescein, often used in surgery. Medications like propofol anesthetic, amitriptyline antidepressant, or Urabel. Though unusual, blue-green urine is typically temporary. But the sight alone can unsettle, leaving a haunting question. What other colors might the body reveal under stress? Cloudy and foamy, when texture tells a story. Color isn't the only clue. Cloudy urine often hints at a urinary tract infection, though infection isn't always the cause. If pain, fever, or abdominal discomfort is absent, cloudiness alone rarely justifies antibiotics. Often, hydration clears it up naturally. But when immune defenses are weakened or pregnancy is involved, medical treatment becomes necessary. Equally intriguing is foamy urine. A strong stream can cause bubbles, but persistent foam may indicate protein leakage, a sign of kidney disease, or even fistulas connecting the bladder to other organs. This symptom, subtle at first, can mark the beginning of serious pathology. Should foam ever be dismissed as harmless? Not when it lingers day after day. The final message in every drop. Urine may seem ordinary, but each shift in color, clarity, or texture carries meaning. From the innocent yellow of perfect hydration to the ominous brown of organ damage, the body speaks through this daily signal. Sometimes the message is simple: drink more water, eat fewer carrots, adjust medication. Other times it's urgent: rush to the hospital, uncover hidden disease, act before it's too late. The spectrum of urine is, in truth, a spectrum of health itself. To ignore it is to silence a voice that warns before the storm strikes. Could it be that in every glass of water, in every overlooked color, lies a chance to protect life? Ana Good believes so, and the evidence agrees.